Well, good afternoon, everyone, and welcome to our daily COVID-19 update briefing. Dr. Ezike and I are joined here in Peoria at OSF St. Francis Medical Center by Bob Anderson, the president of OSF, Dr. Michael Cruz, Chief Operating Officer of OSF Healthcare, and Monica Hendrickson, Administrator of the Peoria Department of Public Health, as well as Leader Jahan Gordon Booth, the state representative from this area who I get to work with in Springfield on behalf of the entire state. The JUMP Simulation Center, from which we speak to you today, served as OSF's launching pad for one of the nation's first pandemic health worker programs. It's a public-private collaboration to deliver telehealth services to any central Illinoisan who needs it during the pandemic, and one of several that the Department of Healthcare and Family Services in Illinois deployed around the state earlier this year at the beginning of this pandemic. Throughout this partnership, we deliver safe, free COVID-19 care to thousands of patients, offering virtual consultations for the vast majority of people who recover from COVID-19 in their homes, thereby reducing the risk of community spread. This program remains in operation and is free to any Illinois resident. Those in need of COVID-19 home care can text CARE, C-A-R-E, and your zip code to 36363. Again, text CARE, C-A-R-E, and your zip code to 36363. This will automatically direct you to OSF Healthcare's program or one of the other two health systems that are providing this service, depending upon what part of the state you call home. The OSF hospital system has been an integral part of Illinois' COVID-19 response from the very beginning, offering innovative, quality care to those in need, whether in person, at the hospital, or through telehealth. And today we stand together again, this time to deliver a message to Peoria and beyond. Cases, positivity, hospitalizations are all rising across the state of Illinois, and we have got to reverse the trend and slow the spread of this virus. Peoria's Restore Illinois region, that's Region 2, is currently the best performing of our state's 11 Restore regions. But a 7.2% positivity average is nothing to write home about, and that's on top of a slight uptick in hospitalizations this month after leveling off in August and September. We've also watched that positivity trend up, down, and back up again in recent months, reaching a high of 7.7% average in early September, coming back down to below 5% on October 4th, and climbing back up over the last few weeks, reaching a 7.2% average as of this morning. I've said before that our knowledge of what works in the battle against this virus has grown significantly since the spring, but the virus isn't going away, and it's constantly looking for new hosts. So we need to use the tools that we have available to us to continue this fight. You hear me talk a lot about masks and social distance, but one of our greatest tools is testing. Testing, testing. People here in Peoria and all across Region 2 are taking advantage of the testing that we've ramped up and made available to you. I'm pleased to see that testing in Region 2 is up 20% in the last 2 weeks alone. In addition to the testing site at the Peoria Civic Center, which is open 8 a.m. to 4 p.m. 7 days a week, we're deploying 2 mobile teams to various parts of Region 2 throughout the week. Today and tomorrow in Bureau County, with additional stops in Peoria, Knox, and Rock Island counties through Sunday. Find the site nearest you at our website. That's dph.illinois.gov/testing. And then check back regularly because we offer mobile sites in new locations all the time to meet local need. And remember, these tests are free and fast and available to anyone who shows up. Outside of Region 2, the remaining regions which have not triggered heightened mitigations are also trending in a bad direction. Region 11, the city of Chicago, is now seeing an average positivity rate of 7.7%, and Regions 3 and 6 are both at 7.8%. And Region 9, Lake and McHenry counties, is reporting its first day of an average positivity rate above the 8% threshold for mitigations at 8.1%. If the region remains above the 8% threshold for the next 2 days, it could enter a period of additional mitigations, possibly later this week. We're seeing a national surge of coronavirus, and Illinois is not immune. Indeed, our neighboring states of Missouri, Iowa, and Wisconsin all have positivity rates and hospitalizations that are in the double digits, positivity rates anyway, and they're soaring. So it's perhaps not surprising that over the weekend, 2 more regions in Illinois, Region 4, Metro East, as well as Region 10, suburban Cook County, triggered our metrics for additional mitigations, meaning that starting Wednesday, 6 of our 11 Restore Illinois regions will be operating under our resurgence mitigation framework. As a result, those regions would reduce sizes of public gatherings to 25 people and temporarily close indoor dining and indoor bar service. If we all do our part by wearing a mask everywhere you go in public, keeping your distance, avoiding public gatherings, and washing your hands frequently, over the next 2 weeks we can reduce new hospital admissions and reduce the positivity rate. That's what it will take so that we can help our businesses get back on their feet and help our kids go to school safely. Much like the 4 areas already operating under Tier 1 or Tier 2 of the plan, that's northwestern Illinois, southern Illinois, Will and Kankakee counties, DuPage and Kane counties, Metro East triggered our 8% positivity threshold, the second time it's done so since midsummer. Suburban Cook County, Region 10, is the first region in Illinois to trigger additional mitigations, not because of its positivity rate alone, but because its positivity rate and its COVID-related hospitalizations have both seen a sustained increase over the last 10 days, mirroring the concerning trends that we're seeing in our hospitals statewide. So no matter where in Illinois you call home, as you go about your daily lives, remember that this is not over. There seems to be a COVID storm on the rise, and we have to get prepared. In the last 24 hours, we've lost another 17 people in the battle with COVID-19. Those are people whose families thought that they would get to see them at the Thanksgiving table. These are our friends and our family members now gone from our lives. May their memories be for a blessing. There are currently more than 2,500 Illinoisans in the hospital fighting this virus. And unfortunately, because we now have so many new people getting infected, that number will likely rise over the coming weeks. Many of those people will survive, but many will have lasting damage to their lungs and other internal organs. Every day, dozens of them are dying. So when we talk about the importance of wearing a mask and keeping your distance, it's because we don't want you to become one of those who don't easily recover. So let's be good to one another. And for the remaining months, until we have a vaccine or an effective treatment, let's follow the rules and keep each other safe. Please, Illinois, mask up, and we'll get through all of this together and to the other side. With that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Thank you, Governor. I'm going to echo much of what the governor has said, remembering that right now, treatment for COVID-19 is limited. There is no cure, but what we do have is prevention. The goal should not be to be lax with getting infected because the chances of survival are good. As we know, it's not clear who will succumb to this virus or not. Yes, it's true that our older members of society and people with pre-existing conditions are among the higher risk, but we have heard countless stories of individuals, even teenagers, with no known medical conditions that have succumbed to this virus. You've heard me say this, and everyone, a million times: wash your hands, watch your distance, and wear your mask. Just to be clear, it's not pick 2 of 3 or pick your favorite one, it's all of them. These measures are additive, and we need to do all of them to help spread the virus. I know I hear people say, well, you know, people die of car accidents, but we still drive. And in driving, we also institute all kinds of ways to limit the number of deaths from car accidents. We tell people to lower speed. There are speed limits. There are airbags. You have to wear your seatbelt. We don't want people driving while they're intoxicated or otherwise impaired. There are traffic signals. It's not just put one thing out there and then don't do the rest, or because there's an airbag, I won't put my seatbelt. Again, additive measures cause increase in safety. As a mother, as a human, I do care about individuals, and I care about their health. As a public health official and a physician, of course that's even more so the case. And so I'm drawing on that medical background and public health expertise to institute practices and measures that will help keep people safe. I've heard a few times now, it's not your job to protect people's lives. I'd have to push back on that. It absolutely is my job. Please just refer to the IDPH website and look up our mission. The mission of IDPH is to protect the health and wellness of the people of Illinois through the prevention of disease, through health promotion, through regulation, to prevent injury. So again, it's clearly stated on the website, it is my job to protect the health of the people of Illinois, and I'm committed to this important role that I've been privileged to serve in for the last year and a half. I can tell you that the number of cases, hospitalizations, people in intensive care, and people who are dying continues to increase. If what we're seeing today does not turn around, we are on a path to see more than 11,000 COVID deaths in Illinois this year. Since yesterday, we received a report of an additional 17 lives lost, as the governor mentioned, for a total now of 9,522 deaths. Today, we are reporting 4,729 new cases for a total of 378,985 total confirmed cases since the beginning of this pandemic. 2,638 individuals were reported to be in the hospital overnight. Of those, 589 were in the ICU and 238 were on ventilators. Of the nearly 4,700, almost 5,000, of the nearly 5,000 people that were identified as new cases, we know that over the coming weeks, certain percentage of those will end up in the hospital, a certain percentage of those will end up in the ICU. The amazing nurses and doctors and respiratory therapists and physician assistants will do everything in their power to minimize the number of those hospitalized and ICU patients that go on to lose their lives. But as valiant as their efforts may be, it might not be enough for all of them. But that's not the end of the story. The people who will get exposed to the virus tomorrow has not been determined. And that is where every one of us comes in. With our mask and our clean hands and our physical distancing, we can prevent exposure to this deadly virus tomorrow, so that on the back end of that, there aren't additional individuals to get hospitalized and to have the healthcare workers fight for their lives and, unfortunately, in some cases, lose that battle. Can we do that for one another? Can we limit the gatherings where spacing gets tricky and we can't minimize our spacing? Every individual has the power, and I would say the actual responsibility, to do this, to help us stop the spread of this virus. Please join me in the mission of IDPH to protect the health and wellness of all of the people of Illinois. Please wear your mask, wash your hands, and watch your distance. Thank you.